Before we start today's episode, I want to start with a trigger warning because we're going to be talking about pregnancy loss and miscarriage. I want to acknowledge that this is a sensitive topic. It may bring up strong emotions for some listeners. If at any point you feel the need to pause or take a break, please do so. Only 5% of women will experience 2 consecutive pregnancy losses, and probably only about 1% of women will experience 3 losses or more that happen one after another. RPL can be a devastating experience, both emotionally and physically. But, our hope is that in talking about the underlying causes and risk factors, we can often help individuals and couples take steps forward to achieving a healthy pregnancy. Welcome to my fertility podcast, Superhumans, the show that brings you expert insights, personal stories, and the latest in fertility care all in one place.
Whether you're starting your fertility journey, navigating challenges, or just exploring your options, we're here to empower you with knowledge, support, and hope.
Join us as we dive deep into topics that matter most, from IVF and fertility treatments to mental health and wellness.
I'm Dr. Mavis Garcia.
And I'm Dr. Wise. We're two of the fertility specialists at Markham Fertility Centre in Markham, Ontario, Canada. Think of us as your sisters in all things fertility. Let's demystify the world of fertility together. On today's episode, we are going to be talking about recurrent pregnancy loss. We're going to be talking about what really is recurrent pregnancy loss and some of the controversy around what the definition is, as well as risk factors and causes.
I have to admit, writing this episode was very difficult. And there's so many aspects to recurrent pregnancy loss that writing an episode on it is almost like writing an entire fertility textbooks, because we can talk about eggs and sperm and the uterus and the body and so many aspects that it's really hard to summarize everything into a nice little package in a podcast episode. The reason that we do this is because we want to summarize really complex information in a way that is digestible for our patient. Let's start with the definition, for example. There is no specific established criteria for recurrent pregnancy loss. In today's world, most of the guidelines talk about 3 or more pregnancy losses. Now, that does not necessarily need to be consecutive. So you can have 2 miscarriages and then a live birth and then another 2 miscarriages, and that would still be considered recurrent pregnancy loss. And of course, we understand that for our patients, 1 miscarriage is one too many. And for us as fertility specialists, we also feel the same way. The reason that we talk about 3 or more losses is not because we feel that you need to go through the pain and suffering of 3 miscarriages before we even start looking at you. We know that miscarriages are very common, and we need to establish some sort of criteria by which we need to differentiate a patient that had 1 miscarriage, which is usually due to a random genetic issue with the embryo, versus those patients that are having multiple miscarriages, in which case it is more likely to find something wrong with the investigation. Like I mentioned, miscarriages are incredibly common. About 15 to 20% of recognized pregnancies end in miscarriage. And even after having a miscarriage, most people will go on to have successful pregnancies, even without having in-depth investigation for recurrent pregnancy loss. If you want to learn more about miscarriages, I suggest that you listen to episode 43 and episode 46.
When we think about recurrent pregnancy loss, even though miscarriages in the general population are very common, only 5% of women will experience 2 consecutive pregnancy losses, and probably only about 1% of women will experience 3 losses or more that happen one after another. RPL can be a devastating experience, both emotionally and physically. But, our hope is that in talking about the underlying causes and risk factors, we can often help individuals and couples take steps forward to achieving a healthy pregnancy.
Now, let's talk about risk factors. The first thing I want to say, a risk factor isn't necessarily a cause. It's just something that if you have this, may increase your risk of having recurring miscarriages. One of the major risk factors for recurring miscarriages is age, or particularly the age of the egg provider. As we talked about in episode 43 and episode 46, as women get older, the risk of a single miscarriage and the risk of recurring miscarriages increases. And this is associated with increase in genetic abnormalities in the embryo. For example, in a cohort study investigating factors associated with pregnancy loss, in 696 women with recurrent pregnancy loss, the age of the female partner being more than 35 years of age was found to double the risk of pregnancy loss compared to women under 35 years of age. There are no studies looking at the impact of the age of the sperm provider in the risk of recurring pregnancy loss, but we do know that DNA fragmentation can have an impact on the risk of miscarriage. Now, DNA fragmentation is more associated with lifestyle factors as opposed to age, but there is no question that the sperm, and specifically the health of the sperm, can also have an impact on the risk of miscarriage.
Another question that we get a lot when we see patients who have experienced a miscarriage or recurrent pregnancy loss is asking us about the impact of stress and the impact of stress on chance of a miscarriage or recurrent pregnancy loss. It's very important to point out that there is no evidence that stress, in the sense of emotional stress, is a direct cause of pregnancy loss. Anyone who can even begin to imagine experiencing a miscarriage or pregnancy loss knows that stress and pregnancy loss are associated, but it's unclear if it's truly a cause. That's when we're talking about emotional stress. There's also physical stress. So, for instance, if somebody is very, very ill, like for instance, in the hospital, potentially having emergency surgery in the ICU in early pregnancy, we know that those things can certainly increase the risk of a miscarriage. So, I think of that as more physical stress, physical stressors on the body. When it comes to emotional stress, even though miscarriage will come with emotional stress, it is not a cause of miscarriage or recurrent pregnancy loss. So, one way to think about it is that we know that when it rains, people will carry umbrellas, for instance. Well, you can't conclude that it's raining just because people are carrying umbrellas. So, again, even though things are associated, one is not necessarily a cause of the other.
Another thing to talk about is smoking. We know that smoking has been strongly associated with many adverse obstetrical and neonatal outcomes. And therefore, we recommend smoking cessation for anybody who is trying to conceive or pregnant. However, a direct association between smoking and recurrent pregnancy loss in the sense of having three miscarriages or not has not been clearly established.
Caffeine is probably the most commonly used drug worldwide. Caffeine may potentially be a risk factor for recurrent pregnancy loss. But again, of course, as always, it depends on the dose. There was a retrospective case control study where caffeine was suggested to be a risk factor for recurrent pregnancy loss. And in people who were consuming high amounts, meaning more than 300 milligrams of caffeine per day, during that kind of around conception period and early pregnancy period, they were 3 times more likely to potentially have a miscarriage. And the study also showed that there was a linear association. So they were actually able to draw a line between the amount of daily caffeine intake and the risk of multiple pregnancy losses. With high consumption of caffeine, there may be an increased risk of recurrent pregnancy loss. Now, the effect of reducing caffeine intake, meaning somebody cutting back on caffeine, whether that will actually reduce the risk of recurrent miscarriages or, quote unquote, treat somebody's recurrent pregnancy loss, that outcome has not been evaluated. But certainly, we know that high amounts of caffeine consumption can increase risk of miscarriage.
Another thing that comes up quite often in the conversation about recurrent pregnancy loss is chronic endometritis. Chronic endometritis is characterized by plasma cell infiltrate in the endometrium, which can be associated with a range of different microorganisms. There have been a series of research studies suggesting that there is anywhere between 7 and 58% prevalence of chronic endometritis in women with recurrent pregnancy loss. Now, this is a really big range, 7 to 58%. One of the reasons that it is such a big range is because it depends on the method of this detection, whether you do hysteroscopy or whether you do specific studies of the lining of the endometrium with an endometrial biopsy. Also, another problem is that there is no specific diagnostic criteria for chronic endometritis. So that's why different studies have given you different ranges because they're using different criteria and different methods of finding chronic endometritis. For example, there was one study published in 2018 where they compared the prevalence of chronic endometritis in women that had recurrent pregnancy loss compared to fertile controls that did not have recurrent pregnancy loss. And they did not find any statistical difference at all between the two groups. However, there was two other studies published in 2014 that showed that treating chronic endometritis with antibiotics actually had an improvement in live birth rate. However, this concept has not been tested in a randomized controlled trial. The European Society of Human Reproduction and Endocrinology stated in their guidelines for recurrent pregnancy loss that further research is still needed, including prospective observational studies and randomized controlled trials, before we consider it routine to screen all women for chronic endometritis in the context of recurrent pregnancy loss.
If you're listening right now and you're getting really confused in terms of what actually causes recurrent pregnancy loss and what doesn't, you're correct.
Welcome to the club.
Exactly. And, what I mean by that is that there's lots of potential ideas and theories out there in terms of recurrent pregnancy loss. But it's really, really hard to kind of tease apart any actual data because, in a lot of instances, the studies have not been done yet. And there are studies that have conflicting findings. And so, navigating this topic and trying to explain to patients who are sitting in front of you in terms of what they should actually do is really hard. And it's a really big challenge. And I think that a lot of what we suggest and what we advise to patients will come from the studies, the literature, but also sort of our experience and sort of what makes logical sense to some degree as well, right? If you're confused, then you're listening properly, then you're kind of exactly where we are sometimes. But I do hope that by the end of this episode, you'll have a bit more clarity.
With that being said, let's talk about the causes. Before we talked about risk factors, now let's talk about what the potential causes for recurrent pregnancy loss are. These causes, we're going to divide them into several categories. Those would be genetic, anatomical, hormonal, immunological, and unexplained. Let's start with genetic causes, for example. One common issue is chromosomal abnormalities of the embryo. This is often due to random errors during the formation of embryos between eggs and sperm. Chromosomal abnormalities in the fetus account for 50% or even more of miscarriage, especially those that happen early in pregnancy. We know that the risk of chromosomal abnormalities in the embryo gets higher as women get older. This is because the aneuploid rate of embryos increases with increasing reproductive age. This happens mainly because of changes in women's eggs as we age. The process of egg division becomes less accurate, and important structures in the egg cells don't work as well as they used to. These changes can lead to mistakes when chromosomes are being sorted out during the formation of an embryo when an egg gets fertilized by a sperm. As a result, older women are more likely to have embryos with chromosomal issues that can lead to problems like miscarriage or genetic disorders in babies. This is why also fertility declines with age and why there is a higher risk of certain genetic conditions, like, for example, trisomy 21 or Down syndrome, in pregnancies of older women.
Another genetic factor is a structural rearrangement in one person's chromosomes. So the person who's either contributing the eggs or contributing the sperm, like a translocation, which can also increase the risk of miscarriage. Just to be super clear here, I think it's worth repeating. Even though we're still talking about genetic causes, This translocation is a genetic thing that we are looking for in either the person contributing the sperm or the eggs, as opposed to what Dr. Garcia talked about, where we were talking about the genetics of the embryo. A translocation is a genetic change where a piece of one chromosome, let's say, has broken off and maybe attaches to another chromosome, or maybe to like a different part of the same chromosome. The way that I think about it, the way that I will often explain this to patients is that, all of your genetic material is like a set of encyclopedias. So, for those of you who are of a certain age who still remember print encyclopedias that you maybe had on a bookshelf when you were small, maybe at your parents' house.
That was me. Are you calling me old?
Oh my God, it was my house too. I mean, I'm only calling myself old at this point. No, the day that this analogy does not work for my patients is a day that I will cry. Anywho, okay. So if you think of the set of encyclopedias, each volume is a chromosome. Okay. Sometimes what can happen is that part of one volume will end up in another volume or stuck to another volume, right? So that set of encyclopedias, that person has a full set. Okay. They are genetically normal. They very, very rarely have any kind of physical manifestations or medical issues as a result of this. But when that person's body is trying to make eggs or sperm, the information is not in the right place. And so the likelihood of making genetically abnormal eggs or sperm goes up a lot. That is something that we can look for as well. If the translocation is, we call it balanced, meaning that there's no genetic information that's been lost or gained. So again, that person, meaning the person contributing the egg or the sperm, may not have any kind of noticeable issues. But it's those unbalanced translocations that can lead to missing or extra genetic material, which can cause issues for the eggs, the sperm, the embryos, and can lead to increased risk of miscarriage and recurrent pregnancy loss.
We have talked about genetic issues, which to summarize can come in two ways. One is in the presence of translocations, and another one is abnormalities in the egg associated with the age of the egg provider. Another potential cause of recurrent pregnancy loss is anatomical causes. We can divide anatomical causes into congenital uterine abnormalities and acquired uterine abnormalities. Congenital means something that you're born with. There are many different congenital anomalies in the uterus. The one that has been most commonly studied is a uterine septum. A uterine septum is a wall that runs through the middle of the uterus, and it is something that people are born with. That's why we call it a congenital anomaly. Just like everything else, if you're following the theme here, there is no conclusive evidence that uterine septums actually contribute to recurrent pregnancy loss. Some studies have said that there is no association, and some studies have suggested that there is an association. For example, there was a study looking at the prevalence of uterine malformations, which the septum is only one of them, and it found that it was higher in women with a history of recurrent pregnancy loss versus the general population. There was also two systematic reviews that reported a higher prevalence of miscarriage in women that had congenital uterine malformations compared to women that did not. These studies were published in 2011 and 2014. There was also a meta-analysis of many studies together that showed that women with a uterine septum particularly, as well as a bicornuate uterus, had an increased probability of first trimester pregnancy loss compared to control.
Certainly, I think we have to do an episode at some point on this podcast, getting into more detail around these congenital uterine malformations. But again, that'll come for a future episode. Switching gears a little bit, under other anatomical causes for recurrent pregnancy loss, we have acquired uterine malformations. So these are things that someone is not necessarily born with, but that can or may develop as somebody gets older. This category includes things like uterine fibroids, uterine polyps, or scar tissue from previous surgeries. Now, if you're interested to hear more about uterine fibroids and their effect on fertility in general, you should check out episode 28 of our podcast. When we're talking about fibroids, polyps, or scarring in the uterus, the clinical relevance and as to whether it has an impact or increases risk of recurrent pregnancy loss is a lot less clear according to the ESHRI guidelines from 2022. Another potential cause of recurrent pregnancy loss can include cervical insufficiency. These are patients who have, let's say, pregnancy loss, but it's typically happening after 12 weeks, maybe around the 16-week of pregnancy mark. Oftentimes, it's characterized by painless cervical dilation, meaning that the cervix opens without somebody feeling significant contractions. Oftentimes, this can be a result of previous cervical trauma, so previous surgeries in the uterus, or it can be something that someone is born with. Cervical insufficiency may potentially be a cause of recurrent pregnancy loss as well. However, it is probably more for patients who are having recurrent losses after the 12-week mark. So we're not going to be focusing too much on that today.
Another factor that can contribute to the risk of recurrent pregnancy loss is hormonal issues. Now, when we talk about hormonal issues, we're talking about very abnormal hormone levels, specifically thyroid disorders and uncontrolled diabetes. Now, the key word is uncontrolled. We check the TSH levels in women with miscarriages very often. Sometimes they're a little bit elevated because the HCG level can interfere with thyroid function and increase the TSH level, but these levels are not usually in the range that would be the cause of the miscarriage. When we're talking about thyroid issues causing miscarriage, it's usually very severe things like thyroid toxicosis or uncontrolled Hashimoto's or very, very severe hypothyroidism. And the same goes for diabetes. Sometimes we have women with diabetes that they can have one blood sugar elevated here and there. And that is not what we're talking about. We're talking about when the blood sugar is constantly elevated and hemoglobin A1C is in the range of 10 and 12. That shows that there is very poor sugar control. And those things can lead to recurrent pregnancy loss. Prolactin is another hormone that is essential to female reproduction and may play a role in maintaining the corpus luteum function and progesterone production. However, testing for prolactin levels is not recommended by the guidelines for recurrent pregnancy loss unless there are specific symptoms associated with elevated prolactin. The studies that have been published about prolactin and recurrent pregnancy loss were very poor quality, did not lead to reliable conclusions. And this is why the European Society of Human Reproduction and Endocrinology did not suggest testing for prolactin levels in the setting of investigating someone for recurrent pregnancy loss.
Another category that comes up when we're thinking about recurrent pregnancy loss is thrombotic disorders. When I say thrombotic disorders, what I mean is that somebody can have a certain condition that may increase the risk of that person developing blood clots. We're not necessarily talking about, blood clots, let's say from a menstrual flow. We're talking about blood clots that can develop in blood vessels in the legs, like a deep venous thrombosis, or blood clots that can develop in the lungs, otherwise known as a pulmonary embolism. And these can be very serious medical conditions. The challenge is that these conditions are not very well understood in the context of recurrent pregnancy loss and how they may contribute. We know that pregnancy, in and of itself, is a higher risk time for somebody to develop blood clots, that they are more prone to blood clots in pregnancy because of the hormonal environment. So sometimes someone may have a certain thrombotic disorder, may not have any blood clots in their life, but they might happen in pregnancy because these things kind of are additive in a way. There are a whole slew of different thrombotic disorders out there that have been theorized to potentially contribute to recurrent pregnancy loss. But again, they're not very well understood, and the evidence is kind of mixed in terms of how to test for these things and how to manage these things, which we'll talk about more. Now, one condition that is sort of a thrombotic disorder, but also an autoimmune disorder, is antiphospholipid antibody syndrome. Antiphospholipid antibody syndrome is a specific condition that is characterized by an increased risk of developing blood clots apart from other symptoms. And this is one of the condition that has been very clearly associated with recurrent pregnancy loss. There are many other things that have also been theorized as potential causes, but there really is just also this really big category of unexplained, where we don't necessarily know what the clear cause is, even after thorough testing. And unfortunately, many patients fall into this category of unexplained recurrent pregnancy loss as well. That being said, there are still options and strategies and things to think about that we can try and help patients who have unexplained recurrent pregnancy loss. We're going to be exploring this further in part 2 of our series on recurrent pregnancy loss. Thanks again for listening, and we'll be back next week. And that's a wrap for today, Superhumans.
If you're looking to connect, get social with us. Follow us on YouTube and Instagram at My Fertility Podcast or visit us online at myconfertility.com. And don't forget, follow, subscribe, and share your favorite episode.
Thanks for listening to My Fertility Podcast and for being a vital part of our community. We know you've got this.
We're signing off until next Tuesday.
If you found this episode of My Fertility Podcast helpful, please take a moment to head over to the review section and leave us your thoughts. Your reviews and comments are incredibly valuable to us and help guide future episodes. We also welcome you to direct your questions to info@myfertilitypodcast.com.
My Fertility Podcast is produced by Rabbit Media Inc. in conjunction with Dr. Garcia and Dr. Weiss.
Music from Mixkit, Life is a Dream by Michael Ramir C.
My Fertility Podcast is not intended to replace any type or variation thereof professional medical, health, or legal advice, nor should the content be taken as medical advice. Please contact your primary healthcare professional regarding any medical questions you may have. The information presented in this podcast is based on the knowledge and understanding of the host at the time of recording. Medical knowledge is constantly evolving, and new research may change the understanding of health-related topics. While we strive to provide accurate and up-to-date information, we do not guarantee the completeness, accuracy, or timeliness of the content. The views expressed in this podcast by guests are not those of the host or the management. This podcast is not intended to impose any type of discrimination. My Fertility Podcast and its management are not responsible for any losses, damages, or liabilities that may arise from the use of this podcast.